If you are over 60 and are taking fish oil, omega-3 every day for your heart and brain, listen carefully to this. Omega-3 is beneficial, but using the wrong dose or using it with the wrong medication can cause harm, prolonged bleeding, heart rhythm disturbances, digestive disorders, and wasting money because of choosing poor quality products. Today, I will explain clearly, easy to understand. What does omega-3 help with? Risks of using it incorrectly, safe dose after 60 years old, signs to stop, and when to see a doctor, how to choose good fish oil to avoid losing money and getting sick. Part 1. What does omega-3 help with? Omega-3 in fish oil is mainly EPA and DHA. Cardiovascular, helps reduce triglycerides, reduce mild chronic inflammation. Brain, DHA is a structural component of the brain, useful for cognition, eyes and joints, may reduce dry eyes, support mild arthritis. Important note, benefits depend on dose and individual condition. Do not take more than is better. Section 2. Risks of use incorrectly. First is the risk of bleeding at high doses or when used with blood thinners at very high doses, especially over 3 grams of EPA plus DHA per day. Omega-3 has an antiplatelet effect, making it easy to bruise, nosebleeds, and wounds that take a long time to stop bleeding. The risk increases if you are taking warfarin, clopidogrel, high doses of aspirin, or other anticoagulants. If you are about to have major surgery or dental procedures, you will usually be told to stop taking fish oil for a while. Ask your doctor for exact instructions according to your medication profile. Warning signs to stop and call your doctor. Easy bruising for no apparent reason, prolonged nosebleeds, bleeding gums, black terry stools, or vomiting blood. Next is the risk of arrhythmia. Atrial fibrillation at high doses. Some recent studies have noted that high doses, about 4 grams per day, can increase the risk of atrial fibrillation in some elderly people, especially those with underlying cardiovascular disease. Symptoms to note: palpitations, irregular heartbeat, shortness of breath, dizziness. If you have the above signs, stop using the oil and see a doctor. Next is the effect of blood lipids and the intestines. Reducing triglycerides, good, but some people may have a slight increase in LDL, cholesterol when using fish oil, especially at high doses. Intestines may have belching with a fishy smell. Nausea, diarrhea. Taking it with meals will reduce discomfort. Finally, the risk of drug interactions and underlying diseases, anticoagulants, anti-aggregation drugs mentioned above. Diabetes, mostly safe at low or moderate doses, but if the dose is increased, blood sugar should be monitored when adjusting. Liver disease, kidney disease, should ask a doctor before using for a long time. Section 3. Safe dosage after 60 years old. The goal is to be adequate, safe, not overdose. Basic nutrition, prioritize 2 servings of fatty fish per week, for example salmon, sardines, herring. If supplementing, the goal to maintain heart-brain health for people without special indications, about 300 to 500 milligrams of EPA plus DHA per day. Need to reduce high triglycerides, usually requires a prescription dose, about 4 grams per day. Only use with a doctor's prescription and close monitoring. Threshold to be cautious. When the total EPA plus DHA exceeds 3 grams per day, the risk of bleeding and atrial fibrillation increases. Do not increase the dose without medical advice. How to read the label correctly. Look for the lines that say EPA and DHA. Do not confuse 1,000 milligrams of fish oil with 1,000 milligrams of EPA plus DHA. Typically, a 1,000 milligram fish oil capsule contains only about 300 milligrams of EPA plus DHA. For example, If the goal is 500 milligrams of EPA plus DHA per day, you may need 1 to 2 capsules, depending on the actual content on the label. Section 4. When should I avoid or stop temporarily? Avoid or stop and ask a doctor if any of the following apply to you: are taking warfarin, clopidogrel, high-dose aspirin, or other anticoagulants. Preparing for a surgery or major procedure, including dental work, always tell your doctor that you are taking fish oil. Unusual bruising, prolonged bleeding, black stools, irregular heartbeat, have a diagnosed heart rhythm disorder, especially atrial fibrillation, doses exceeding 3 grams of EPA plus DHA per day without a doctor. S. Prescription. Part 5. How to choose worth the money fish oil. Third-party certification. Prioritize labels with inspection such as USP, NSF, IFOS, helps reduce the risk of oxidation, heavy metal impurities. Clear EPA plus DHA content. The label must state how many milligrams of EPA and how many milligrams of DHA per serving. Natural triglycerides or re-esterified triglycerides are often better absorbed than ethyl esters in some people. Taste. If the capsule is too fishy or has a rancid smell, change the brand. Store in a cool place, maybe in the refrigerator, to reduce the fishy smell. Take with a meal containing healthy fats, such as olive oil, avocado, to increase absorption and reduce fishy bumps. Part 6-60-second Fish Oil Safety Roadmap. Step 1. Take the bottle of fish oil you are using. Read the EPA and DHA. Add them together. Step 2. If the total dose is greater than 3 grams per day without a prescription, immediately reduce to 300 to 500 milligrams per day, or as recommended by your doctor. Step 3. Check your medications. If you have warfarin, clopidogrel, high-dose aspirin, call your doctor to ask if you should continue taking fish oil. Step 4. Set an alarm to take it with your main meal. Monitor for bruising or nosebleeds. If you have any unusual symptoms, stop and see a doctor. Conclusion: omega-3 is beneficial, but taking the wrong dose, the wrong way, the wrong time can be harmful, especially after the age of 60. The safe formula is: take the right dose, read the label carefully, avoid drug interactions, ask your doctor when necessary.